Hi, my name is Nancy Gomez, and today we'll be discussing the different audiology settings that a certified audiologist can practice in, to include the type of services they offer, the equipment they may use in the profession, and other professionals who may work in these settings. But first, let's go ahead and define what an audiologist is. So an audiologist is someone who identifies, assesses, diagnoses, treats, and prevents auditory or vestibular impairments. That basically means hearing or balance disorders. They also work to prevent those disorders from happening. So where do audiologists work? That is the main questions that we'll be covering today, and we'll be covering the settings, but we'll be mostly focusing on educational and medical settings. So they do work in educational and medical settings, but they can also work in universities, in pediatrics, in industrial settings, or even recreational settings where they mostly focus on canines. But today we'll be focusing on educational and medical. So again, in educational settings, their primary focus is on children and the services that they provide to children, the responsibilities is to identify the hearing loss, and making sure that they provide good referral management and rehabilitation. Rehabilitation can include auditory training, counseling and guidance to parents and teachers and pupils about hearing loss, and evaluation of individual and group amplification. And this will be further explained in the next slide. So in the educational settings, the equipment that will be used is hearing assistive technology systems, also known as HATs. HATs can include FM system and sound field systems. So as I said previously, for evaluation of amplification, audiologists can go ahead and assess the rooms of each individual classroom and see how the sound or the surround sound is in that room. And they can go ahead and install sound field systems, which is here in the bottom. This little white, it looks like a speaker. So this white speaker is called sound field systems, and the audiologist can go ahead and set up these systems in the classroom settings to make sure that the children, especially those with hard hearing, can go ahead and hear better. Especially the classroom instructions. And the FM systems are up here, and these are usually given to children with hard hearing, or those who have cochlear implants. But FM systems, according to ASHA, can help help the child hear the teacher's voice and can hear their own voice in classroom settings. So the FM system is particularly important for children because the environment gets so loud, they're gonna have to hear that instruction. So the FM system helps to clarify the teacher's voice and even their own voice, whether how close or how far they are from the teacher, they'll be able to hear the teacher clearly. As for professionals in the education system, audiologists can work with speech-language pathologists, especially if the child is having hearing and speech communication issues, or they are diagnosed with speech and language hearing disorders. They will be working along with educators of the deaf and hearing impaired children, counselors and social workers to let them know of the progress or the diagnosis of that student, and also teachers. As I said, they are audiologists in the education system are more likely to go into the classrooms and assess the classroom environment and see what needs to be fixed in that environment. And again, it might be installing sound field systems. The information again provided by this slide is by Martin and Clark and Asha. So moving on to medical settings. Medical settings can vary for audiologists. They can work in physicians, in hospitals, in clinics, or even private practice. But for this slide, we'll just be focusing on hospital settings. In hospital settings, they work with newborns, children, and adults. Again, they can specialize with veteran newborns or veteran children or veteran adults, depending on the hospital they are working in. But according to ASHA, their services can include measuring hearing ability. They can administer and interpret screening, assessment, and diagnostic procedures. Again, and I quote, design rehabilitation programs to heal patients, learn to identify sounds, and again, assess amplification devices such as hearing aids or even the environment. Continuing on, these are the different devices that you'll possibly see in a medical setting. The equipment can include commercial sound level meters, which is this one right here on the upper right-hand corner. Computerized rotational chair, that's mostly for balance disorders. Pure tone odometer, which is right here at the bottom. And speech odometer, which is up here in the middle. These pure tone odometers are designed, and I quote, designed to deliver pre-selected frequencies at examiner-selected intensities to determine an individual's hearing sensitivity. And the speech odometer is the same thing, however, it measures, and I quote, measures hearing sensitivity for speech and for tones via either air or bone conduction. So these are practically the same, but this one just measures hearing sensitivity and speech. It's mostly in regards to speech, but the professionals for medical audiologists, they work with speech language pathologists again, otolaryngology specialists, which is specialist in the ear and throat area. Surgeons, again, when a patient is trying to get a cochlear implant, they may be working with the surgeons in an IPP team, so interprofessional team, physical therapists, and physicians. But mostly that is what medical settings is about. The local clinic here in Abilene, Texas, is the Holland Hearing Center. They've been providing hearing services for approximately 19 years, and their services include comprehensive hearing assessments. They do hearing aid technology. They specialize in that. Tinnitus assessment, earwax removal, teleaudiology, something that is coming new into the field, and hearing aid repairs. So in case there needs to be a repair, there are specialists in that local clinic here in Abilene that can provide that in the area. But so far, that's all I have for today. These are my references. And thanks to SlidesGo for providing the template and the pictures, unless specified in the bottom that it was given by another resource. But thanks to Slides2Go for contributing to my slideshow. And thank you for listening. Have a great day.